This podcast is for educational purposes only and is not medical advice. Peptides are research compounds and not FDA approved for general use. Always consult with a qualified healthcare provider before starting or stopping anything related to your health. Welcome to the Peptide Effect, Peptides Made Simple. I'm your host, Piper. Today's episode covers the basics. What is a peptide? How do they work? Which ones are the most popular and effective? We'll also talk about peptide storage, reconstitution, BAC water, dosing, and sterile injection basics. Peptides are short chains of amino acids, the building blocks of proteins. They act as messengers in the body, giving specific instructions to cells. When peptides bind to receptors on cells, they trigger different responses such as growth hormone release, tissue repair, reduced inflammation, or brain effects. Some of the most popular peptides include BPC-157, TB-500, CJC-1295 combined with ipamorelin, GHK copper, Cmax, and C-Link. If your goal is healing, BPC-157 and TB-500 are most effective. For growth or fat loss, CJC-1295, ipamorelin, tesamorelin, and AOD-9604 are often used. For brain support, Cmax and C-Link are common. For anti-aging and skin health, GHK copper and epithalon are key players. Peptides usually arrive as a white lyophilized powder. They are fragile and should be stored in cool, dark conditions. Reconstitution is the process of adding sterile liquid to the peptide powder. Backwater, which contains 0.9% benzyl alcohol, helps prevent bacterial growth and extends shelf life. To reconstitute, draw BAC water with an insulin syringe, inject gently down the vial side, and let the powder dissolve naturally.
Do not shake.
The amount of BAC water used determins peptide concentration. For example, a 10 mg peptide combined with 2 milliliters of BAC water equals 0.05 mg per insulin unit. Once reconstituted, peptides should be stored in the refrigerator, not in the door, and kept away from light and temperature changes. When figuring out dosage, it's helpful to use educational tools to understand typical ranges, then confirm with a peptide dosing calculator to measure syringe units accurately. Sterile injection basics are essential. Always use sterile supplies, wipe vial tops with alcohol, use a fresh needle each time, clean the injection site, and inject slowly. Peptides are powerful messengers with roles in healing, growth, brain health, and anti-aging. They require careful handling, reconstitution, and storage. This podcast is educational only and not medical advice. Always consult with a healthcare provider before considering peptides. Until next time, stay curious and keep learning.